Welcome, parents and professionals, to today's webinar about helping toddlers 1 to 3 years sleep and settle. Thanks for joining us. I'm Chris Tran, psychologist, and I'll be your host for today's session. We're coming to you from the lands of the Wurundjeri and Bidjigal people, and I'd like to acknowledge the traditional owners of all the different lands we're on and pay my respects to elders past and present, and also to any Aboriginal and Torres Strait Islander people with us today. This webinar is live and we'll be interacting with you through polls and activities. You can also ask us questions and share your ideas at any point by using the discussion forum on the right-hand side of your screen. The webinar is best viewed on a computer or laptop, but you can also use other devices. If the video stops, try to refresh the web page. We're joined by Susan and Anne, who will be your moderators in the discussion forum today. But if you have any technical problems, please click the live support button at the top. Also, we want to let you know that this webinar is being recorded and a link to the recording will be sent out next week to everyone who's registered. So keep an eye on your inbox. This webinar has been brought to you by the Raising Children Network and has been developed by the Parenting Research Centre. We'd also like to acknowledge the support of the Victorian Government in funding this webinar, which is why we're able to bring it to you at no charge. If anything discussed here today upsets or concerns you, here are a few places you can go for further help. raisingchildren.net.au has the numbers for Australian helplines and hotlines for your state, and also a parent line. There's also Lifeline, which is a 24-hour crisis support line, and you can also find more information at australia.gov.au. This webinar is best suited for families with toddlers aged 1 to 3 who want to learn about sleep and settling for their toddler. It contains general advice. We encourage questions, so please ask them during this webinar. We will focus on questions that could apply to more people in the audience rather than just specific cases. If you have specific questions about your children, please contact your local professional. If you haven't already seen it, we've opened some polls, so please put in your responses there. We'd love to learn about you and who's in the audience. You should also see that on the right-hand side of the screen. If there's any issues with that, feel free to put your answer in the discussion forum instead. The question we have is, are you here with a particular child in mind? How old is this child? And you can choose between 12 to 24 months, 2 to 3 years, younger than 12 months, older than 3 years, and I'm here as a professional. So we can see a bunch of people have put in their votes so far, so thank you very much for that. We'll give another minute for people to put in their responses. Just a reminder, if there's any issues, you can put in your response in the discussion forum. And so far, it looks like we have a tie between people thinking about a 12 to 24-month-old and 2 to 3 year olds, both at 34%. And then 20% of our audience are professionals. And then we have a few people, 6% thinking about a child who's younger than 12 months, and 4% thinking about a child who's older than 3 years. Thank you, everyone, for putting your responses in. We'll just end that, but if you haven't had a chance, feel free to just put your response in the discussion forum. All righty. So let's move on. So if you need to leave early today, that's completely fine. We would really appreciate your feedback via the survey before you leave. That's in the handout section on the right-hand side of the screen. Your responses here will help us make these webinars as helpful to you and other parents as possible. Our speaker for today is Dr. Fallon Cook, pediatric sleep practitioner and researcher. She's co-director at Infant Sleep Australia and works closely with parents of babies and toddlers who are having sleep difficulties. Fallon has developed pediatric sleep programs and has received several awards recognizing her contribution to infant sleep research. Welcome, Fallon.
Thanks so much, Chris. Thanks for having me, and welcome to everybody who has tuned in today. Um, I know there are a few professionals here as well who are tuning in for a bit of PD in sleep, which is absolutely brilliant. And I'm sure there are plenty of very tired parents. So I hope you've all got your toddlers down for a nap and you're ready to, yeah, really get stuck into learning about sleep and settling in the toddler years. So, my aim today is for you to take away some really useful and practical strategies that you can think about with your own toddler. So, we're going to learn a bit of general information about toddler sleep. We're going to talk through some of the more common sleep problems and some strategies that might help. And we'll also talk about how to seek help for your toddler's sleep if you're having really persistent difficulties. So, why is sleep so important? What's really interesting is that we know that, of course, the amount of sleep your toddler has is really important. But interestingly, the sleep factor that's really strongly linked to health and well-being is actually the number of nighttime wake-ups that they're having. So, how fragmented their nights are. We know that toddlers who have really persistently interrupted nighttime sleep tend to struggle a little bit in the daytime. So it might be that it's a bit trickier to learn new skills. It might be a bit more of a struggle to acquire language, friendships, and just adapting to new experiences. The toddler years are really critical for brain development, and long, restful stretches of nighttime sleep seem to be quite important for supporting that development. So, I know a lot of parents often harbour a bit of guilt around wanting to improve their toddler's sleep, but you really don't need to. Sleep's really important, and it's a really great thing to be working on if you are, having some troubles with your toddler's sleep. So, what does toddler sleep look like? So first of all, what I would say is that toddlers, age 1 to 3 years, are capable of learning how to settle themselves off to sleep without needing hands-on support from a parent. But we certainly know that many toddlers will need a little help mastering that skill. Learning how to fall asleep without help is a really important skill for toddlers because they're starting to explore their world more. They might be meeting new carers, attending childcare, and soon enough they'll be off to kinder and then school. And what we know is that if they're able to settle themselves off to sleep for their day nap, then they do tend to do a little better during the day when they're cared for outside of the home. And they also tend to then have more restful nights as well. And this really helps with their cognitive, social, and emotional development. So, a bit of an overview at around about 12 to 18 months, lots of toddlers are dropping to just one nap a day. And from 2 to 3 years of age, most toddlers are dropping their day nap altogether. Toddlers aged 1 to 3 years need somewhere between about 9 and 15 hours of sleep per 24 hours, but most are going to average around 11 to 12 hours of sleep. So it's a really huge range of normal. Some toddlers genuinely do only need 9 hours of sleep per 24 hours, and they do really well on that amount of sleep. So important to remember huge variability in what's considered normal. So keep this in mind and try not to compare your toddler to other toddlers. You might know some other toddlers who actually need closer to 14 hours of sleep. It doesn't mean that they've necessarily got better sleep health. It's just that they have a higher requirement for sleep at that time. Um, and do keep in mind that if your toddler seems to average around about 12 hours of sleep per 24 hours, and they're always having, a 2 hour day nap, then you might only be able to expect them to sleep about 10 hours overnight before they kind of wake up ready for the day, having met that 12-hour sleep need that they have. And if you do keep trying to push them to sleep for longer overnight, that's often when they start to be very wakeful and very, very hard to settle because they simply don't require that much sleep. So, thinking about how much sleep your toddler averages can be really helpful in just making sure that you're just giving them enough opportunity to meet that need and not aiming for, a whole lot more than what they truly need. You'll know your toddler's getting enough sleep if they're mostly, happy and content during the daytime. But we always keep in mind that this is an age where tantrums are pretty common, even in the most well-rested of toddlers. But they should still be having some stretches of happy, settled playtime in amongst a few tantrums throughout the day. And sleep is possible. So, if your child's not getting enough sleep, or they're not settling well, or maybe they're waking up a lot overnight and not settling back to sleep, don't panic. There is a lot that we can do to help. There's a lot of support out there. So often in clinic, parents with toddlers will turn up and say, it's too late. I've left it too late. They'll never sleep now. I should have addressed this when they were a baby. They really feel like they've kind of missed the ship. But it's absolutely not the case. We can treat sleep problems in someone who's 100 years old. We can certainly still treat them in a toddler. Excuse me. All right, it is really important to be across a few potential factors that could be impacting sleep. So, when there's a medical cause for sleep or settling difficulties, sleep's probably not going to change until we address those medical causes. So, some really key things to be on the lookout for are things like excessive vomiting, dry, rough skin, or eczema. If they've had poor weight gain or unusual poos like mucousy, frothy, slimy, watery poo or blood in their poo. And really importantly, keep an eye out for snoring or coughing and gasping during sleep. And also a lot of mouth breathing during sleep. So if there's any kind of snoring or interrupted breathing during sleep, it's never normal. I think a lot of parents think, oh, they snore a little bit, but it's kind of cute, nothing to worry about. But if it's persisting, please see your GP. It would be a great idea to get a referral to an ear, nose, and throat specialist that can just check if there's anything going on there that needs to be addressed. So yeah, if any of those factors on the screen sound familiar to you, really good idea to chase it up with your doctor. So we're going to move on to talking about some of the common sleep problems that parents report and some strategies to help. So you've got some tips and tricks that you might be able to try out with your own little one. So the two most common sleep problems we tend to see in the toddlers who attend our clinics are bedtime resistance, where they really don't want to go to bed and they'll do anything to avoid falling asleep. And the other common problem is when they're needing a lot of hands-on help to fall asleep, and then they wake up overnight needing that same hands-on support to get back to sleep. And often these are the toddlers that wake up quite a lot overnight. In order to really understand how to best improve these types of sleep problems, it's so important to think about what it is that's driving those sleep behaviors. So sometimes toddlers just have very, very strong preferences about how bedtime should go. They might like to have some sense of control over their bedtime. But other times it's more to do with them having some separation anxiety, or something might be going on in their life that's causing them to want to seek out more comfort from their parents. And of course, there are toddlers who have just very ingrained habits that are actually getting in the way of them getting the sleep that they need. And how we would think about treating sleep problems will always depend on what that driver is of those sleep problems. So we're going to sort of dive into these in a little bit more detail and go into some strategies as well. So you might like to jump into the chat now and pop something in there about the sort of sleep problems that you're facing with your toddler if you want to share. I think it can be a great way to feel a little less alone because so often parents are dealing with reasonably similar difficulties. All right, so if your toddler is resisting bedtime, then usually bedtime has become very, very stressful for you. And often it's actually stressful for the toddlers as well. And typically parents will say, oh, bedtime is, yeah, really, really taking a long time because they're very, very resistant. What you might notice is that your toddler could be repeatedly getting out of bed. Or they might stay in bed, but then they make, really excessive requests like, I need another drink, I need one more story, I need another blanket. Or, the one I love the most is when toddlers decide that this is the perfect time to ask these huge, big questions about, the meaning of life. And often it's questions about space for some reason. So those sorts of behaviors, often your toddler's thinking, I think I can keep my parents here a little bit longer if I do a few different entertaining things and make some extra requests. So of course, with any of those behaviors, they're going to happen every now and then. But if it's usually or always taking 20 minutes or longer for your toddler to fall asleep, and they seem to be really actively trying to avoid falling asleep, and especially if you're feeling really frustrated and you're really dreading the bedtime routine, I would say then, it's really time to do something about it. And when it comes to that bedtime resistance, there's not sort of a quick fix to it or a magic wand that we can wave. We always have to kind of think about multiple factors and work on various things at the same time to make sure we're kind of addressing all bases with bedtime. Okay, so the first thing we're going to do, and a lot of parents will go, oh, yes, I've been told this before, but it is super important. Have a really clear bedtime routine, one that it doesn't really change and that's very predictable. And make sure you praise your toddler when they're following their bedtime routine so they're feeling really proud of themselves. It goes a long way when we're just saying things like, oh, you brushed your teeth like a champion. That was fantastic. They love that. And of course, second would be, be consistent with it. Really try and avoid changing the routine. As a parent, it's super easy to feel really overwhelmed by tantrums and upset or never ending requests. But, take a breath and carry on with it. It is really, I think these are some of the more challenging parenting moments in toddlerhood. But, you are the parent and you know that their needs have been met. You know that they're ready for sleep. So it's okay to persist with that predictable routine, which might mean saying no to some extra things being added. They really do settle quicker when they know that you're only going to do the same thing. So you're always going to be consistent and predictable. And typically, toddlers just won't settle down quickly for sleep until they realize that that bedtime routine does not change. So, how you could approach this is, obviously it depends on various factors, but you might say, do your bedtime routine, say goodnight, leave the room, and if they keep calling out, kind of wanting you to come back every few minutes, you might go back, but say to them, it's time for sleep, and then go again. And if they're trying to really engage you in, questions and answers and, all this sort of discussion, a really helpful tip is just to simply say, we can talk about that in the morning. So you're really showing them that we're just not going to enter into big discussions about space and the universe right now. It is sleep time. And then the next morning at breakfast, say to them, hey, what did you want to tell me? So you can show them that you follow through. You're interested in what they've got to say, but there's a time for discussion and it's not bedtime. Yeah. All right. The other thing I'd be thinking about, particularly for older toddlers, is creating a bedtime routine chart using some pictures and having it stuck up on their bedroom wall. So it's a very visual representation of the order of things that happen at bedtime. It means that your toddler can see what happens next, and I highly recommend that you give your toddler the job of telling you what happens next in the routine. It gives them, a little bit of a sense of control, but we are still sticking to, the same order of things. Make sure you include all the steps of their routine. So brushing their teeth, putting pajamas on. It might be that on the chart you show how many books or stories they're going to have, how many songs. You might include your kisses and cuddles and things like that. So really try and cover everything that your child is likely to want to do in that bedtime routine and that's reasonable to do in a bedtime routine. But once you've worked through that chart, it's lights out, no further requests will be honored. It is time for bed. So it's a great way of just making sure you're meeting all of their needs and that when it's time for sleep, that's it. It's time to leave them to it and go off to sleep. Another option, if bedtime has started to really stretch out, is to think about moving bedtime a little bit later. So, a good example of this is if you're putting your toddler to bed at 7 p.m. every night, but they never fall asleep before 8 p.m., chances are they just are not ready for sleep until 8 p.m. Their circadian rhythm is just thinking, nope, 8 p.m. is when I'm going to sleep. So if you move the entire bedtime routine later, so you're saying goodnight at 8 p.m., you're very likely to see a whole lot less resistance to falling asleep simply because their sleep pressure or sleep drive is really high at that time. And if you've been tracking their sleep in a diary, you've got the evidence there. You can see actually 8 p.m., is when they're really looking to sleep. So that can work really well, often means they settle a lot faster and then they're practicing falling asleep without all the demands and all the other things they used to do. Once they are falling asleep quickly at that time, you can move bedtime 10 or 15 minutes earlier each week until it's at the desired time you would like it to be at. All right, let's talk about toddlers who have problems falling asleep and staying asleep. Sleep onset difficulties are, includes things like when toddlers need a lot of hands-on help to fall asleep at the start of the night, and then they want that same support to fall back asleep every time they wake overnight. And it's really normal for humans in general to wake multiple times overnight. We do a little systems check that things are all okay, and we typically go back to sleep and don't remember it. But toddlers who have a lot of help to fall asleep often wake up overnight and think, where did you go? Come back. So I like to use this analogy to kind of explain this phenomenon. Um, if we think all the way back to kind of, caveman times when there were predators, maybe tigers and things roaming around at night, the humans who survived were simply the ones who would wake up easily if something changed or moved in their sleep environment. So, like a, tiger creeping into the cave. This tendency to wake up when sleep environment changes is, of course, far less important today because we tend to be sleeping in much safer places. But that tendency to kind of wake up and do that sort of systems check has still persisted. So if, for example, your toddler falls asleep in your arms, maybe, or during a feed, and then you transfer them to their bed or the cot whilst they're asleep, they'll be much more likely to wake up during the night. When they do, they often feel really confused. Sometimes they're very cranky or mad that you've dared to put them down in their bed. Sometimes they're even a little bit scared and a bit freaked out to find themselves, not in your arms anymore. They really dislike that unexpected change, and almost always they will want that same support they had at bedtime to get back to sleep again. And much like, I often sort of say to parents, think about your own sleep. So if you fell asleep in your bed, but at 2 a.m. you woke up and you were lying on the couch, you wouldn't just go back to sleep. You'd wake right up. You'd feel confused. You'd be a bit freaked out. How did I get here? What happened? And you would want to go back to your bed with the same pillow, the same blanket, everything that you had at the start of the night. And then you would eventually get back to sleep again. So, yeah, it's certainly relevant to humans at all ages and stages. So, as I mentioned earlier, it's really important to think about the cause of your toddler's reliance on you to fall asleep, as this is really going to determine what sort of approaches you're going to use to improve their sleep. There's definitely no one size fits all approach. We see so many different variations on toddler sleep behaviors in our clinics that the advice we give is never the same for two toddlers. So, really important that we tailor to the individual need. So, of course, that makes it kind of tricky to give you guys good advice in the scope of a webinar where I don't get to meet all your individual children. But what I'm going to do is give you an overview of the real key factors that I want you to be thinking about when you're trying to decide what sort of approach you're going to use for your toddler. So typically settling difficulties come down to one of the three factors you can see there on the screen. So separation anxiety is when your toddler is very fearful of you leaving them. They don't want to separate from you. Another factor is that they might just be seeking extra comfort and one-on-one time. And this often happens if they're unwell. Definitely happens a lot when a new sibling arrives on the scene. They often want a lot of your attention at bedtime. If they're, maybe started at a new childcare centre or there's been some other really big life change, they're likely to want to seek extra comfort from you. Or the sleep difficulties or settling difficulties could be due to preferences and habits. So they might just simply enjoy having you, hold them, pat them, cuddle them to sleep, and that's started to become a habit. And now they're just at a point where they just cannot easily fall asleep without sort of having you there to do that thing. And they wake up often wanting you to come back and resume doing that activity. So let's dig into each of these a little bit more. So separation anxiety is when your toddler is really fearful when separating from you, and it often is linked more strongly to one particular parent. It usually happens in the daytime and at night. So if you're only seeing tricky behaviors at nighttime or bedtime, it might actually be that there's more of a preference to keep you near at bedtime rather than a fear of you leaving them. So it's pretty easy to confuse the two. But just keep in mind that your toddler's fear is very real to them and be prepared to make some very gradual, gentle adjustments to how you're settling them until they're able to confidently put themselves to sleep without needing your help. And this is super important. Slow and steady wins this race every time when it comes to separation anxiety. Just making gradual changes, gently persisting, it's going to help your toddler feel more and more confident that they can fall asleep without you present. If we move too fast, it can backfire and cause a bit of a peak in anxiety, which is definitely best avoided. So let's have a chat through a case study. I love to talk about families and their experiences. It kind of brings it all to life a little bit. So we're going to talk about Emily. So Emily was 18 months old and she was very fearful separating from her mum. So she would scream and cry if her mum tried to leave the living room, even, even if it was just really briefly when Emily was playing. She'd get very upset at bedtime when put in her cot because she knew this meant that her mum was going to leave the room once she fell asleep. So she was really trying to delay falling asleep for as long as possible to avoid that feeling of waking up and finding mum wasn't there. When she'd wake up overnight and her mum wasn't sitting near the cot, she'd get very, very upset and cry loudly. And Emily would often spend the rest of her night in her parents' bed because it was just too hard to resettle her in the cot. But the problem with this was that no one was sleeping well because Emily was just constantly waking to check her parents were still there. So for some families, they'll bed share and find it works really well for them. Everybody sleeps well, but this certainly wasn't the case for Emily and her parents. So, what they did was Emily's mum set up a mattress on the floor beside Emily's cot and just started to sleep there all night. So, at first, Emily was still waking up overnight and crying because she was hoping to go and sleep in her parents' bed. But Emily's mum responded, just giving her a cuddle and some reassurance, and then she'd lay down on her mattress while Emily fell back asleep in her cot. She sometimes had to reach through the side of the cot to pat and reassure Emily. And she also gave Emily lots of cuddles. So every 10 minutes or so, she'd stop, give her some cuddles, help her calm down, and then go back to settling again. After a few nights, Emily started to resettle herself during the night because she wasn't fearful of her mum leaving. So she knew that mum would be around all night. And she also knew that bed sharing was no longer an option, that the cot was where she would be spending the full night. After a week, Emily's mum started to move her mattress a little bit further away from Emily's cot and started to reassure Emily with her voice rather than with the padding. After another week, Emily's mum started to periodically leave her mattress. So she'd say to Emily, "Oh, I forgot my drink bottle. I'll be right back." And she'd leave Emily for maybe 2 or 3 seconds before returning to her mattress again. So, really importantly, she didn't leave Emily so long that she got really upset, but just long enough that Emily started to build her confidence waiting on her own for brief periods. So, just giving Emily that chance to realize, "Oh, I'm actually okay if I'm here for a moment without mum." Emily's mum found that she could leave for longer and longer until Emily would fall asleep waiting for her mum to return. And that was all without tears because it was just a very gradual build up to leaving for longer. And when this started happening, when Emily started to fall asleep without her mum in the room, she also started to resettle herself overnight without needing her mum to come in at all. Because her mum wasn't there when she fell asleep, she woke overnight and wasn't upset or worried to see that her mum wasn't there. And she was able to easily get back to sleep on her own. So that's a very gradual approach. It really gave Emily lots of time to build up her confidence and avoided triggering Emily's separation anxiety. And it did take a few weeks, but we know that toddlers with separation anxiety really can't be rushed. And the family reported too that Emily's separation anxiety started to reduce at other times too, because she wasn't so bothered at childcare drop off. She'd had lots of short, manageable opportunities to practice separating from her mum, so it really translated to other aspects of Emily's life. So that's just one example of an approach you could choose to take if your toddler has some separation anxiety. It won't be the right fit for every family, and that's totally fine. But we just have to look at the individual needs of the family and of the toddler as well. Okay, so sometimes toddlers aren't scared of you leaving them at bedtime, but they're just looking for a little more closeness and one on one time. And this usually happens when there's been a really big change. I know a lot of parents of toddlers, probably ones that have tuned in, might have a new baby, and often that's when sleep and settling at bedtime goes quite wobbly. If childcare begins, or if a loved one leaves or is less present, it can just make toddlers look for that bit more comfort at bedtime. Sometimes too, your toddler will realize that at nighttime you're a bit less busy and more available for cuddles. So they'll call out, kind of knowing that they can catch up on cuddles in the nighttime. And whilst initially, these periods happen all the time for toddlers, Initially, they might only want really brief reassurance and then put themselves back to sleep. But just keep in mind that some toddlers kind of go, well, this is lovely and I'd love more of this, thank you. So they start wanting their parents to stay for longer and longer during the night and to give them more and more and more help to get back to sleep. And this can then turn into a habit, and night waking can then start to really increase. So if your child has one of these bumpy patches, they're looking for a bit more support, give some support and reassurance, but if you can, aim to leave their room before they fall back asleep, and that'll stop that from sort of turning into a habit and causing some overnight difficulties. All right. If your toddler's had some big life changes lately and is seeking you out for extra cuddles during the night, it can help to increase one-on-one attention during the day. It might make it a bit easier to decrease how much support you're giving them during the night to fall asleep. So you can use lots of approaches to fill their bucket during the day. Strategies we use a lot with families in our clinics is called special play. And essentially, special play aims to kind of fill their bucket, gives them a big dose of very close one-on-one attention where you're minimizing distractions where you're doing that special play and you're entirely focused on your child's play. And this can be particularly helpful, especially when there's big life changes, to show your child that I still protect this time to play with you before the big event. Maybe it's the arrival of a sibling and you practice special play in the lead up. Once the baby arrives, I still protect that little bit of playtime that's just for us. And then, further down the track, it's maintained as well. So for a lot of parents, it's easy to maintain a little bit of focused play every day throughout those transitions, and it can ensure that bedtime sort of stays on track and manageable. Special talk is another super simple strategy that can be really easily built into the bedtime routine. What we typically say is for a minute or two when your child's tucked into bed and before you say goodnight, your aim is just to say all the lovely things. And I've put some examples here, but you definitely should, make up your own lovely things. But it might be things like, I'm so proud of the wonderful person you are. I'll love you forever. I love you with all my heart. And definitely cater that to your own toddler and what they might want to hear. So there's been some great research showing that saying these things before bed has a really positive impact on sleep overnight. All right, so once you've regularly started to do special play and special talk, you can start to reduce your presence while your toddler falls asleep. So remembering this is for the ones who are just wanting a little bit more attention and focus at bedtime than what they previously did. So for example, if you've been laying in bed beside your toddler while they fall asleep, you might say, okay, I want to sit on their bed instead. Or if you've been sitting on their bed while they fall asleep, maybe you're going to sit in a chair or stand by the door instead. And if they get out of bed, you're just going to gently guide them back to bed. So this can work well for the ones who they haven't really got this ingrained habit. They've just got a little bit of a preference to have you a little bit closer at bedtime. It might take some persistence, but aim to be really boring and repetitive. So what would typically say is don't engage in conversation. Like I sort of said earlier, actually, you could say, we'll talk about that in the morning. Just aim to sit or stand quietly. You might even close your eyes to show them that it's sleep time. Or some toddlers will respond better when their parents are out of sight, out of mind. So in this case, you could really quickly reduce your presence at bedtime, simply just coming and going from their bedroom every 2 or 3 minutes or so. Provide brief reassurance each time and then go again. And this works really well for the toddlers who kind of like to know you're still around, but they actually settle more easily when you just kind of leave them to it. So it's definitely not for everyone. There'll be families that say that would never work for my toddler, and that's okay. But there will be some parents out there who think, yeah, they actually do better falling asleep when I give them a bit of space, but they definitely want to know that I'm still around. So you can just check back in every 2 or 3 minutes, and that can often work really well. All right, now let's talk about the toddlers that have very intense habits or preferences about how they fall asleep. So this is going to include the toddlers who are always held or always fed to sleep, and they almost never fall asleep without some form of intense support from their parent or caregiver. And when this happens, it is extremely exhausting for parents. It's often mistaken for separation anxiety because reactions tend to be very, very extreme when parents do try and encourage their toddler to fall asleep in their cot or their bed without help. And often these toddlers are caught in what I kind of call the escalation trap, and it makes it really hard to make progress. So, an example of this is if a toddler knows that if I cry really, really hard, my parent is much more likely to kind of give in and go back to what they used to do or try something different, then they just will be really quick to go straight to 100% crying. If you've got a toddler who does this, you'll be nodding along. You know what it's like. It's really, really challenging to work through, but it is possible to work through. So, if your toddler's settling difficulties are co occurring with separation anxiety, then you definitely need to opt for that gradual approach we talked about earlier. That's super, super important. But if there's no separation anxiety, you can move a little bit faster. So, an example could be that you put them down in their cot or their bed, you say goodnight, and then you come and go from their room every 2 or 3 minutes. Each time you go to them, you might give them the same consistent reassurance. Try not to vary what you do. For example, it might be that you give them 10 pats and say, I'm right here, it's time for sleep. And then you wander away for another short interval before repeating the process. This works really well for some families. Other families are like, nope, that's not for us, and that's completely fine. But when you are with any approach, if you're really consistent and predictable, doing the same thing every time, that avoids that drastic escalation in crying. Your toddler's realizing it doesn't matter if I get really cranky about these changes. Mum or dad or my caregiver just consistently does the same very boring and very repetitive reassurance. And that can really help them to calm down. And of course, pick your toddler up for a cuddle every now and then, every 10 or 15 minutes. If they're really worked up and you think, I'm not getting anywhere with this, give them a cuddle, have a little break. But once they're calm, it's back in the cot and keep going. So you're showing them that it's okay in the cot, we can do this, but you're giving them lots of opportunities for some support. And do keep in mind, you can stay in their room if that's what you prefer to do. Some parents know that leaving the room works a lot better for them and for their toddler. Others say, no, if I sit on a chair nearby or even just sleep on a spare bed near the cot, that helps my child to feel more calm and eases that adjustment. So I really can't stress that enough, actually, that you are the parent, you're in the driver's seat, you know your toddler better than anyone else. So it's okay to change these approaches to really fit your child's individual needs. So if you're using this approach, you've waited a few minutes and they sound like they're calming down and putting themselves off to sleep, you would always wait a little bit longer just to not interrupt them if they are about to put themselves off to sleep. It's going to take a lot of patience and a lot of practice, but when you keep doing the same thing each time, they start to understand what to expect. They feel a whole lot less motivated to keep calling out because they can see that mum or dad's still around. They're not changing what they do. They're being very predictable, and I'm still getting lots of reassurance. And soon enough, they will be putting themselves off to sleep and not needing that high level of support. It can be really hard work changing ingrained sleep habits, especially when they've been going on for months or years. So definitely decide on one strategy you're going to use and be prepared to persist for a couple of weeks. Try not to chop and change sort of every couple of days. It can be really confusing for your toddler and can keep a lot of the upset at bedtime going on and on and on. Definitely ask family and friends for support. And if it's not working out, definitely seek help. Okay. Sleep pressure is another factor that I really want all parents to be thinking about. So, a lack of sleep pressure or sleep drive can be a huge contributor to sleep and settling difficulties. Excuse me. When your child is waking up from a sleep, their sleep pressure is typically quite low, and the longer they're awake for, the higher that sleep pressure is going to grow. And some toddlers, in fact, a lot of toddlers, have sleep difficulties simply because their sleep pressure is not high enough at night time. And this is usually because they're having a bit too much day sleep or they're napping far too close to bedtime, or there could just be a lot of variability in their daily rhythm day to day. Signs that low sleep pressure could be contributing to your toddler's sleep difficulties include things like waking before midnight or having what some parents will call a false start. It's where their toddler wakes not long after falling asleep, so they're not getting a really deep stretch of long sleep at the beginning of the night. If they're waking for long periods during the night, we often call these biphasic or split nights. Usually, when this happens, your toddler's awake for maybe an hour, 2 hours. I saw one the other day that was awake for 4 hours in the night. They're basically just waiting for that sleep drive to build back up so they can get back to sleep. Also, persistent early morning waking can be another sign, or if it's taking them just a really long time to fall asleep at the beginning of the night. So, if any of those things sound familiar, it could be a sleep pressure issue that's influencing your toddler's sleep and settling. And in that case, it might be worth trying to reduce the total daytime sleep. It might be time to drop a nap or push bedtime later. And if that's not helping, then definitely seek support from a sleep specialist. All right. So, look, some toddlers will have little upsets in their sleep that kind of come and go. That can be really, really normal in the toddler years to have a few little rough patches with sleep. But for some toddlers, they have very ingrained sleep and settling difficulties that require treatment and monitoring from a sleep specialist. So, if you have tried several approaches with no progress, seek specialist help. Sleep is so important for well-being, and poor sleep that persists, we know is associated with increased difficulties with mental health, physical health, cognitive development. And just know that it's never too late to work on sleep. Like I was saying earlier, so many people just think, oh, they're a toddler now, I can't fix this. Of course you can fix it, and it's well worth working on. Sleep problems really do happen at any age, and it's also best to address these difficulties in the toddler years before they're heading off into early education. Where turning up to kinder or school feeling refreshed and ready to learn becomes super, super important. If you're needing support, have a chat with your health nurse or your family doctor or a pediatrician if you have one. And this can be really helpful for just ruling out potential medical causes for your toddler's sleep difficulties. If you have one nearby, your doctor might refer you to an early parenting centre. Some early parenting centres do take toddlers as well as babies. In an early parenting centre, they can give you more of that hands-on support that you might be needing. Your doctor might also refer you to a sleep clinic where a doctor skilled in treating sleep difficulties can assess your toddler and advise you on next steps. If you're looking for additional support and you want to do a little bit of reading, the Raising Children's Network has a treasure trove of great articles to do with toddler sleep. So it's a really good place to start. We also run sleep clinics, and we have our Sombal Pediatric Sleep Clinic programs for parents who might not want to see us for an appointment, but are really happy to work through some online materials and watch our videos and work towards better sleep via those approaches. So there's lots of support available out there. Don't be afraid to reach out and find it. All right, so here are my 4 key takeaways from this webinar that I want all parents to really keep in mind. So I've said it a couple of times, but I'm going to say it again. Sleep is really important for health and well-being, not just for your child, of course, but also for you as a parent. It can be really hard to have the happy, joyful experience of parenting that you might have envisaged for yourself if you're feeling constantly exhausted and fatigued. You've got to look after yourself. So do keep that in mind. Don't harbor any guilt that, oh, I should just put up with this for however long it lasts. You don't need to do that. You can take action and things will improve for everybody. Bedtime resistance and settling difficulties are so common, but they can be resolved. And often parents are stunned at how quickly their toddler's sleep can turn around once they've got a really clear plan in place. And often it does require sitting down with someone and addressing all the different factors, the ones we talked about today, and there's others as well, but just to make sure that every base is being covered. That's often what it takes to really make permanent and lasting change. Like I said earlier too, choose one approach and stick to it consistently. You might not have 2 weeks in you, but try and give it a week at minimum. Your child needs to see that you're just going to do the same very boring, very repetitive, very reassuring things each time. And that will stop the pushback. They'll realize, okay, there's not going to be a whole lot of chopping and changing and different things happening at bedtime. And that's when they start to settle down. And do seek help if problems are persisting. There's definitely help available. You don't need to continue on feeling exhausted. So I hope that's been a helpful presentation and gives you some some things to think about in terms of what might be driving your child's sleep problems. And maybe it's just been good preparation for some parents too who are about to enter toddlerhood. I hope it's been helpful. So we're going to have a little Q&A session now, which I'm really excited about. So I'm going to invite Chris to come back online and he'll be asking me some of the questions you've submitted.
Thank you so much, Fallon. A lot of good stuff in there. Um, so just quickly before we jump into the questions, a reminder that there's a feedback survey on the right-hand side of the screen in the handout section. Again, this is going to help us make these webinars as helpful to you as possible. And also, there are a couple of places that you can go if you're concerned or upset by anything that we've discussed. And also a reminder that there's a free app to help you support your child and tweens mental health. All right, let's jump into the questions. We've had a lot of questions, so hopefully we can get to yours. But thank you so much for putting these through. Let's start with the first one here from David. So he's got a 3-year-old daughter who only wants him to put her to bed and also only wants him to settle her when she wakes during the night. She'll even tell mum to get out of the room. Is there a reason for this kind of attachment to one parent, and what might be a good next step?
Yeah, it's so common for toddlers to kind of pick and choose a favorite, but try not to be offended because before you know it, it'll switch over and your toddler will only want their other parent. So yeah, they really can chop and change with that. If you're wanting to make progress forward, where you want to get to a point where both of you can settle your daughter, it might be a case of practicing some of the bedtime routine elements together. So rather than it just only being David, bring your partner into some elements of that as well. And if your daughter's really reactive and cranky when they see their other parent, that's okay. You know, it's not that you need to go and change anything or send the other parent out of the room, never to return again. Let your toddler have those big emotions. They'll calm down again, and then you keep carrying on. So, yeah, build them into parts of the bedtime routine so that your daughter gets used to the other parent being around. And over time, you'll find it gets a little easier. It often just takes that bit of practice and persistence, but it is important to do because if only one parent is ever settling a toddler, it just means there's one parent who can never really be out in the evening without the other parent having a terrible time at home, can limit that kind of freedom that each parent has. So, yeah, I'd say choose how you're going to approach it, select an approach, and then share that settling and gradually increase the presence of both of you. And then, David, you'll be able to kind of phase your presence out a little bit, and hopefully you'll be able to have a little bit more freedom in the evenings as well.
Amazing. It sounds like just a couple of steps that might help with that. So we've got a question from Claire. So she's saying that once they had their second child, their first child, who's 14 months, started to have difficulty falling asleep, as you were saying earlier. Is there much that they can do to help the 14-month get back to settling?
Yeah. So definitely, it's often the case for firstborns that the arrival of a sibling is just nothing we can really prepare them for. They are going to get a little bit less of our one-on-one attention as parents. And that can really be a challenge for them to adapt to. So often at bedtime, they're like, I'm not going to let you go. I want to keep you here a bit longer and a bit longer. That's where special play can be super effective because even if it's just 5 minutes a day where you say, hey, let's do our special play together. And it can be challenging for some families because you're trying to make it just you and your toddler at that time, but you're just entirely immersed in their play. You tell them, we're starting special play. You tell them when it ends. And if you try and do that each day, then your toddler's realizing that, yeah, mum or dad, they have a little bit less time for me now that they're juggling a baby, but my special play is always protected each day. That can really help to reduce that demand for extra attention at bedtime because they're kind of thinking, well, I got my special play, I've had my fill of mum or dad or my other caregiver. So it can really help in that context just to have a little bit of dedicated time. That you can protect because we can't be on all the time as parents all day, every day. But just having little short doses can be super helpful. And that's something that you'll probably use right across childhood whenever you feel like your child is just needing that little bit more of a lean in from you.
Thanks so much. That's super helpful. So we have a question from AL. They've got a 20-month-old. They co-sleep with the toddler and also breastfeed the toddler to sleep. Upon waking, they either breastfeed the toddler or they assist the toddler to settle for a longer period of time without the breastfeeding. What are some next steps that might help the toddler settle on their own?
Yeah, okay. There's so many ways you can go. So it sounds like, yeah, you're wanting your toddler to settle in their own bed. I'm going to assume you want them in their own bed all night and not feeding to sleep at all anymore. So the first thing I'd be thinking is often it's easier to stop the feeding to sleep whilst they're not always, but whilst they're in your bed. So if you're stopping the feed to sleep, but you're not implementing any other strategy, you can give them all the hands-on support in the world. They can have all the cuddles they want. They could be rocked. You can do anything you like to reassure them, but it's just a firm no, we're not feeding anymore. So your first step is just getting rid of the feeding to sleep overnight. You might even look to drop night feeds at that point too. So you're really focusing on giving them other ways of falling asleep without needing the breast. So it could be patting, cuddling, anything like that. Once that's out the way, it then becomes a whole lot easier to think about putting that child into their own safe sleep space. It might be that, you feel like you can absolutely go straight to a cot. You might even set your bed up right beside their cot, reach through the side of the cot and give them constant hands-on support while they're adjusting. Or if they're going to go into a bed, again, you might still stay really close to them during the night, but you're just getting them used to being in their sleep space and they're still getting lots of support. Once they're used to being in their sleep space and not in your bed anymore, then you start to gradually reduce all that hands-on support and the parental presence. So I'm assuming those parents are probably feeling pretty overwhelmed with how much work there is to do to get to that point. Focus on one day at a time, break it down into those small goals. And you're probably a family who would benefit from additional support. So if you're needing, a bit of a sleep plan and, a sort of targeted kind of approach that you're going to use, then seek some support with that because it can make all the difference having a really clear plan to follow.
Thank you so much. So let's go to the next question, which is from Bronte. They've got a 15-month-old. They rock the baby to sleep. When the baby wakes, sometimes rocking helps, sometimes feeding helps, but it's not very consistent. These approaches don't always work. They do co-sleep because they're feeling overwhelmed and they're trying to get some sleep themselves. And their question is, would weaning help baby improve her sleep? Are there any other general tips?
Weaning might. It might be that your child is thinking, well, I'm definitely going to keep waking up because sometimes I have a lovely feed, sometimes I get to co-sleep, and they might really enjoy those things. So they're just going to keep waking up for as long as those things are offered. So it could be that you start by reducing those things. But I kind of see a lot of families where they say, I need some other approach. Like, what am I going to do, when they wake up and I'm not trying not to do the very things that would normally settle them. What we always start with in the clinic is looking at that daily rhythm and just making sure there aren't any kind of periods where sleep pressure is just dropping too low overnight. Because if they're maybe overdoing the day sleep even slightly, that can mean that when you try to move to a different approach, it's impossible. There'll be parents out there who understand this too, who have been so persistent with a new approach and they've really persisted for a couple of weeks and not got anywhere. And then it turns out that's actually a difficulty with the circadian rhythm, with the daily rhythm that we need to kind of make some adjustments. Once we make those adjustments, then it becomes easier to try a new settling approach. So for that family, it's worth thinking about that daily rhythm. Look, it might be easier just to get some support with the daily rhythm first so that you've kind of got that base covered and then start to work on, some different settling approaches. It could be that you choose one from today's presentation and just apply it really consistently. I think for a lot of families, it does come down to having the daily rhythm just right so they've got enough sleep pressure and sleep drive, plus then bringing in that consistent approach. If we try and bring in the consistent approach, but the sleep pressure is a little bit off, that's when families go back and forth and never quite make that progress that sticks. So yeah, if that would definitely be something to think about, the daily rhythm and then what approach you're going to use.
Amazing. Thanks for that. So we've got a question from Laura. They've got a 3-year-old who needs them to sit next to him once they do the nighttime routine. And the current routine is the light goes off, bedtime stories are put on, and then that that works pretty well. If they don't follow their routine exactly, then it sounds like maybe he tantrums and they all end up staying awake a bit longer. The question is, yeah, is this kind of creating a bit of a habit that becomes a bit rigid? What can they do about this?
Yeah, so some toddlers are very particular and really want everything to happen just so in their bedtime routine, or they do just go, right, we've got to start it right from the start again. Some toddlers are just going to need that, and some parents will just need to make sure they've got that routine perfect every time because their toddler has that very high need for consistency and predictability. If you think it's more to do with them, it could be that they're not super tired and they're pushing back a bit, they're making extra requests. I'd definitely be looking at what time they're falling asleep, moving that bedtime a bit later. And just being really, I'd use a bedtime routine chart as well so that you can put it in picture form and show them we did that, we did that, we did that. We are on track, we've done all the things. And just be thinking about, when they say they put on bedtime stories, I'm assuming it's an audio book or something like that that plays until the child is asleep. It could be that they're waking up overnight and kind of going, where are my stories? I want them back again. So sometimes audio at bedtime is brilliant. It just helps toddlers to kind of switch off and get into that. Sleep is a process of letting go. So sometimes a story can help them do that and it can be really useful. Other times it can mean that, yeah, they're wanting to hear more and it kind of takes them longer to fall asleep. I hope that answers that question. It can really be 50-50 on whether the toddler has that real need for a very rigid experience at bedtime, or yeah, whether it's about parents more just going, okay, this is the boundary we're setting, bedtime ends now, it's sleep time.
Yeah, so some things to try out and test out. Yep,
Yeah.
cool. So we've got a question from Toy. So they're asking if screen time during the day affects sleep, and if so, what might some effects be?
I love this question. This has been a really hot topic in the sleep research lately. There's a big debate about whether screen time is really going to impact sleep. But what I would say is this: screen time during the day isn't going to be sort of so bright that it's going to reset your child's circadian rhythm, because just being outside in daylight provides them with thousands more lux, which is a measure of the light, than a screen ever could. So having some screen time in the day probably not going to impact bedtime. Sometimes screen time can get in the way of them napping, and if they reduce their day naps, they're probably just going to push a little bit more sleep into their night. Um, what I would probably say for toddlers is try not to have the screen as part of the bedtime routine. But I say that with a huge caveat. And the reason for that is there are some toddlers that are really wound up, super full of energy, and the screen time, and try and keep it maybe 30 minutes away from bedtime, but a little bit of screen time, might be an episode of Bluey or something for 5 minutes, is what helps their body be still. And then they become calm, and then they're much better able to get into a calm bedtime routine. So screen time can be helpful if you're using it as a tool to actually help your child be calm so that then you can have a good bedtime routine. But yeah, you probably want to keep it 30 minutes or more before you actually do your bedtime and say goodnight.
Thank you so much for that. Let's squeeze in another question. So Ashley asks if you have any general tips on transitioning from a cot to a bed.
Yeah, so put it off for as long as you can. It takes a while for toddlers to realize that they're supposed to stay in a bed. So a very young toddler is just not going to get that memo, and they might just keep constantly getting out of bed because they just don't understand that they're supposed to stay there. Keep them in their cot until it's not safe to keep them in their cot. So if you're noticing that they're pretty good at climbing, they've managed to, they're trying to get one leg up over the side of the cot, you're going to have to make that transition to a bed at that time. When you do make that transition, it might be that you can keep some of the things in the cot present also in the bed. So if they've got a comforter, you would definitely put that in the bed. And be thinking about safety. Put a safety gate on their bedroom door because no one ever thinks their toddler is going to get up in the night and turn the oven on until they do. They can, as a parent, you're going to be deep asleep for hours overnight and you might not hear your toddler. So keep the safety gate on the door. Make sure there's nothing dangerous in their rooms, no loose cords for the blinds, power points, things like that. Go to the Red Nose website to learn about how to set up a safe bedroom so that then when they're in that bed, they're going to be safe. Yeah, they're probably my best tips for making that transition.
Those sound really, really important. A lot of good safety tips there. No, thank you for answering all those questions, and thank you everyone for asking those questions. And also thanks for your time to everyone, especially to you, our speaker, Dr. Fallon Cook. Everyone, before you leave, just a reminder, we've got that survey in the handout section on the right-hand side. We hope you found this valuable. We've covered a lot today, so if you want to revisit it, keep an eye on your email inbox where you'll get a link to the recording. And also, the Raising Children Network has a range of resources on this topic and others, so please explore that if you haven't already. Have a great rest of the day.